Hey there, this is Beth Hovis, your sweet urban living lady, and I am really excited to welcome this particular guest to our Sweet Urban Living podcast. I have known Rosetta for several years now, and I'm really pleased to share her story with you, or let her tell her story. So welcome, Rosetta. It's really good to have you with us today.
Thanks, Beth. I'm so excited to be here. This is going to be fun. I'm excited to be on your podcast. Thanks for inviting me.
Yeah, thank you. Thank you for being here.
Mm-hmm.
It is a fun time. So let me just introduce Rosetta. Rosetta Kawauchi has been called to guide others on their healing journey for over 30 years. You began your career as a registered nurse, correct?
Yes.
Yeah. And that was in
Yes.
1994. Yeah. Now, you also hold licensure as an ecclesiastical holistic practitioner through the GEHA. We pronounce that GEHA. That's GEHA, and is board certified as a naturopathic doctor. As the founder of Essence of Healing, Rosetta combines her extensive background in integrative massage, specializing in craniosacral and polarity therapies from the Kalamazoo Center of Healing Arts. With other advanced training and certifications in natural health and holistic wellness, Rosetta is also a published author in Lifestream Journal, where her writing reflects her passion for helping clients find restoration and balance in body, mind, and spirit. Rosetta, your approach to natural health has been shaped by your mentor, Dr. Gail Houser, and another mentor, Dr. Barbara Briner. And you say that they inspired you to blend your faith in Jesus Christ with a whole person model of care. Now, you also tell me that you're studying for your PhD. Is that correct? Or have you already earned your PhD?
Oh, no, not yet. Not yet. I'm in the process of my goal is to complete my PhD in naturopathic medicine through Kingdom College of Natural Health by next year. So,
Wow.
but sometime
You have
in
a lot.
2026.
I mean, it was like, yeah, I was reading through all of the accomplishments, and I'm like, wow, you have a lot that you have gone and done the
Thank
training.
you.
So you started out with caring for others. You were drawn to nursing first, but somewhere
Correct.
along the way, you moved from nursing to natural health care. Tell us about that story. What prompted that shift? What happened in your life that made you go, hey, I need to explore natural options?
Well, I always knew I was guided to help people.
Mm-hmm.
So when I started out as an RN, I was 20 years old when I received my RN my license to work
Okay.
as a registered nurse. Some years passed, and I married my wonderful husband, Dr. Ronald Kawauchi. He's an oncologist. So it was kind of a cute little story how we met. I was a nurse and he was a doctor. We met at the ICU over a patient. Anyways, so we got married, and we had 4 beautiful children. Okay.
Nice.
And, so at that point, I just became a stay-at-home mom, and my best job. I love being a mom.
Yeah.
So my 2 middle boys, at a very, very young age, were diagnosed with autism spectrum disorder. So my husband and I, we just started just going down the line of conventional treatment, because that's what we knew. We were Western medicine minded, and we did everything recommended. So all the specialists did all the therapies. And this went on for a couple of years of doing this. And I didn't see any improvement. And what was worse is my 2 middle boys, and they're not twins, by the way, they're about 18 months apart. So my 2 middle boys, they were nonverbal, and they would just scream in pain and frustration.
Yeah.
And they would cry all day long. So that's when we decided I'm going to look up a new perspective. So I looked up naturopath. I never heard of a naturopath before. Never heard of it. And So her title, she used to be an RN too. So I thought, oh, I could talk. We could talk about nursing stuff. I could connect with her on that level.
Mhm.
And so her title was RN and D. And I said, oh, I said, ND. I said, did you get your nurse doctorate? Because I'm a nurse. She said, no, that means naturopathic doctor. So that was my first introduction there. So we started out with my boys doing NATE therapy. So NATE, NAET. And I know you're familiar with that,
Yes.
Beth, but for anyone watching, it stands for Dr. Nambutropad's Allergy Elimination Technique.
Right.
So we did not have success with that, and we did it for several years. But what this naturopath did show me was Reiki.
Okay.
So she showed that to me, and I learned I could probably use this beautiful energy from God. I'm going to try it because nothing else is working for my boys. So I learned how to do Reiki for my boys, and once I asked God to bring this beautiful energy through me, and for the best of intentions for my boys, their screams suddenly stopped, and they looked very peaceful and very happy and very comfortable. And so then I knew I was onto something, that my boys resonated at a much higher level with this energy work that I'm unfamiliar with. So I went on this big learning curve to try to catch up to the level of understanding of where my boys were. And I knew that I had to be the one to do it. So I'm very
Yeah.
thankful and blessed that God chose me to be the
Mm.
mother of these
Mm.
beautiful boys.
Wow.
It taught me so much. Having my boys has put me on this path here.
Mhm.
So the more I worked with my boys, I learned of other therapies. I learned of cranial sacral therapy. So
Mhm.
I would take my boys to a massage therapist who specialized in that. And then when she quit, I figured, I have a license to touch. I'm an RN, so I'm going to
Mhm.
learn this technique. And then I did. So I worked
Wow.
on my boys with that. So
Mhm.
as they were in the ABA, that's Applied Behavior Analysis, it's a therapy for children with autism.
Mhm.
There's different goals that used to have different behavior goals and educational goals. But as soon as I started working on my boys and just practicing on them through my class,
Mhm.
they started just mastering out their goals. They would hit 90% or 100%.
Wow.
And,
That's
and they
interesting.
so the more I learned about that, I would find different pieces of the puzzle that would help my boys.
Mhm.
And still, I was not a naturopath yet, but then I found a different naturopath I could work with, a Dr. Gail Houser,
Mhm.
who really guided me to take a deep dive into my guidance with Jesus Christ,
Mm.
and to do the plan, to pursue the plan that God had for me.
Right.
Um, so so she would work on my boys with different naturopathic remedies and homeopathy, and the whole family used her.
Mhm.
And we were so impressed with how gentle these therapies were and these
Yeah.
remedies, and how there were no side effects. And
Mhm.
my boys and myself and my husband too, we just love Dr. Gail. So I really wanted to learn how to be a naturopath, and she guided me more towards initially a different healing technique called esoteric healing, where I met Dr. Briner. I became certified in this technique called esoteric healing. So I'm certified. I'm a certified practitioner now of esoteric healing through the National Association of Esoteric Healers. So she guided me to initially take this path. She told me this was my gift as a healer.
Hmm.
Of course, I'm a healing facilitator, and everything comes absolutely from Jesus Christ.
Right.
Everything. I started out that way. And then when Dr. Gail passed away in 2021, and she was a Trinity School of Natural Health graduate, I believe in 2007 or 2008, then I just knew I'm going to go to Trinity, and I'm going to pick up the torch where she
Yeah,
had gone. So
that's
I could serve
awesome.
my family and the community. Yes.
Yeah, that's awesome.
Mm-hmm.
So one of the
Mm-hmm.
things that I want to go back to that you did say as you were telling all of the different
Mm-hmm.
things is you were
Mm-hmm.
introduced to a lot of different modalities that did
Right.
work. And
Mm-hmm.
even though the NAET didn't work for you, it
Right.
does work for other people. And
Right.
that's the beauty. And to me,
Mm-hmm.
that's the beauty of the holistic naturopathic field is
Mm-hmm.
if one thing doesn't work or if something isn't
Mm-hmm.
as successful, it doesn't mean we just throw up our hands and give up. There may be
Mm-hmm.
some other answer out there that is
Mm-hmm.
for you that
Mm-hmm.
may not work for somebody else. A lot
Mm-hmm.
of times we want that one thing to be a one size fits all
Mm-hmm.
for everybody, and it's a lot of exploration of what fits.
Mm-hmm.
So it sounds like that's kind of what you did as you went through a what works
Mm-hmm.
for me, what works for my family, where
Right.
do I get training and help that show that to other people. So
Mm-hmm.
that's very cool that
Mm-hmm.
you know found something that worked, found something that actually was
Mm-hmm.
part of your identity, if that makes sense. It's
Mm-hmm.
like not only were you a
Yeah.
nurse, because a lot of times I found that a lot of my guests even have started out in the medical field because most of us
Mm-hmm.
don't realize that there, like you said, we don't
Mm,
realize that
yeah.
there is such a thing as naturopathy. So the only
Right.
choice is to be a medical provider, which is great. I have a son who's a paramedic, a daughter-in-law who
Mm-hmm.
is a nurse, and we definitely need that. So that is a great, if
Mm-hmm.
that's where you are, awesome.
Right. Mm-hmm.
Okay, so as you're telling this and you're sharing, that's where
Mm-hmm.
we met, was at Trinity School.
Mm-hmm.
Yeah. So
Right. Right.
yeah, I was one of the instructors. You were and
Oh, yeah, and I was so thankful. I had you for so many classes,
yeah,
and we formed just a nice relationship. So I
we
was very
did. We
thankful
did.
to have you as my instructor.
Thank you. Yeah, so
Yeah,
I taught
yeah.
several different courses there for a while, and have lots of great relationships. And there are some like yours that just continue
Mhm.
to grow beyond, outside of the classroom, beyond. And so that's one reason I'm glad to have you. So you're doing all this now for your family, for your boys
Right.
specifically, and that's
Mhm.
been how many years ago would you say that's been, and how are they doing today with you mentioned a little bit about how it helped them, but how are they doing today because they're older now.
Yes, they are. They're 18. One just turned 18, and
Wow.
then one is 19 right now.
Yeah.
So my 19-year-old is actually doing very well. He's in a work program. He is talking so much. I have to tell him his name is David. And he talks at a higher volume. I'll have to say, David, whisper, 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 and bring them. But
Yeah.
he talks, he reads, he's in a work program. He's pretty functional in the house. He tries to get his dinner prepared, kind of faster than I can keep up, and I'm behind him just trying to clean off the countertop because there's this long trail behind him.
Yeah.
But
Yeah.
he goes shopping. We
Wow.
have someone with him right now that goes shopping with him.
Hmm.
But he's just doing fantastic.
That's awesome.
He reminds me of all the street signs when I'm driving. He'll tell me, "Do
Hmm.
not pass."
Yep.
Okay, but so now he reminds me, cross the double line, right? And
Yeah.
I don't, but
No,
he reminds me.
but
Yeah,
he's
yeah,
watching out for you.
yeah,
Awesome.
yeah, yeah. And my other son, John, oh, John, he's my heart. They
Yeah.
both are.
Yeah.
Yeah, John is on a little bit of a different path. So,
Mm.
yeah, John's on a little bit of a different path. So, we're going through some other things with him right now, but
Mhm.
regarding his screaming and
Mhm.
crying and pain,
Mhm.
he doesn't have any of that anymore, and
Wow.
he is just completely loving. And he's a jokester. He's always telling jokes all the time, and
Yeah.
he always wins everybody's heart. So he's a good guy. He's like a little guy, except he's 230 pounds and he's really a big guy.
Yeah.
Yeah, but he's on a little bit of a different path, but
Yeah.
yeah, all in Jesus's light. And yeah, so every time, especially John, every time I look at him, I see the face of Jesus, and I
Mm.
know, there's more work to be done. Yeah.
And that's one of those things where, on one hand, it's like I have a lot of clients myself who they
Mhm.
want immediate results. They want immediate
Mhm.
turnaround. They want
Mhm.
all of the symptoms of these kinds of issues gone.
Mhm.
And
Mhm.
what you just shared is, sometimes we can get a great reversal, and sometimes we get some. We have growth,
Mhm.
we have change, we have all of that,
Mhm.
and we don't give up, but it is a lot of times the natural health, the holistic approach
Mhm.
helps us to take back our health in increments in certain
Mhm.
areas and things like that.
Mhm.
And so that is, to me, that's again a beautiful part of natural healing
Mhm.
because your
Mhm.
children are functional, you know.
Mhm. Yeah.
Even though John is on a different path than David,
Mhm.
he's still
Yeah.
more functional than he would have been if he hadn't had what you
Right.
discovered. Yeah. Okay,
Right.
so you did this for your family, but now you're helping others. How did that
Yeah.
transition? When did you decide, okay, I'm going to move out from just helping my family to now I'm going to help other people as well?
So before I became a naturopath, my company was originally started here in Okemos, Michigan, as a healing, as an energy healing business.
Okay.
So there were different people I would reach out to and work with them. And then they started asking me a lot of questions about naturopathy.
Mm,
And at the time, I wasn't a naturopath, so I didn't quite have the answers. So after my mentors, they both passed away. After
mm,
they both passed away, I just knew I would pray and I would meditate on it, and I would ask Jesus, where would you like me to serve people now? And do you want me to focus on my family? Or
mhm,
is there, you want me to have more outreach? And then I could hear in my prayers that he will bring people to me that
mm,
I can help. And so I knew my outreach was something, my next phase of what I have to do. So, so that's kind of how I guide on what I'm going to do. As I always refer to Jesus and ask
mhm,
him, where is my next step here? And
mhm.
he'll let me know what my next step is. So, and then from
Very
there,
good.
here comes another step, and here comes
Yeah,
another step.
yeah.
So I'm very happy. And he is also letting me know to, keep reaching out to people, that there's a way they can get blessed through me
Mhm,
from him, just by working on them. So, and I
mm.
always want to make sure that I'm following his plan for me. Yeah.
Excellent. So you started out because you said you were able to do the cranial sacral because you have a license to touch. So being
Mhm.
an RN means you can actually touch the physical body because you're licensed,
Right.
and you don't have to be an RN. Just for those who may be curious, you don't actually have to be
Mhm.
an RN to do cranial sacral technique, but you do need to have some kind of a license to touch somewhere so that you're covered, because that's different. In naturopathy, we don't tend to touch or manipulate the body if we're doing herbs, or like me doing iridology or things like that.
Mhm.
So it is a little bit different. So that's where you, with the essence of healing, the energy healing, the cranial sacral, when did you transition to actually doing like naturopathic consultations where you're now asking the client, well, what are you
Yeah.
eating? What are you drinking? Those kind of
Yeah.
things.
Other than my family, which I started in 2022, when I started reaching out to other people, it was the beginning of last year, 2024, in January.
Okay.
So yeah, so that's when I transitioned from just working on my family to working on more of a broader reach. So I've been working on others now with naturopathy for probably coming up to 2 years right now. Yes.
That's really cool. Is there a certain segment of clientele that seem to be drawn to you, that you kind of help the same issues over and over again? Is there a specialty area that you're working with?
A lot of people that reach out to me right now are mostly women in their 30s to 50s, and they're asking me for hormonal balancing,
Mm,
and I do that.
okay.
So they're reaching out to me. But what I did find is there's a huge segment of the population that's overlooked, and it's men's health.
Mm-hmm.
So I actually have a large male clientele coming in because the big focus is women's health, and that's the
Mm-hmm.
big money maker.
Mm-hmm.
And in the men, I mean, they're kind of forgotten. So I have probably, which is a large percentage of my clientele, but I have about 35% men that come to me, and they're, I mean,
Nice.
some are 23. My youngest male is actually he's 18,
Mhm.
and my oldest male is almost 72. So
Wow.
they're coming, yeah, so they're
Yeah.
coming to me. My absolutely youngest client is 18 months old.
Oh,
And I love having the kids here. And my oldest client is 84 years old.
wow.
So, but I would say, I mean, my biggest question is women's hormonal balancing
Mm-hmm.
is what's
Yeah.
coming to me.
And I
Mhm.
think, that's interesting when you say, it's like we don't mean to overlook men. But
Mhm.
for me in my business, it was like the women were the ones who would come search me out most of the
Mhm.
time. I would have
Yes.
the occasional man um, be the one to search me out and then bring his family. But
Mhm.
usually it was the wife or the mom or the
Yeah.
girlfriend who was like,
Mhm.
they found me first. And then they were
Yeah.
like, you need to go see her. And that's how
Yeah.
I got
Yeah.
my male clients. So I think, that's really interesting. It just makes my head start thinking thoughts of how do we reach these men to let them know that there is actual help for them? You know,
Mm.
like even my husband this
Yeah.
morning, he's like, I watched this because he watches whatever it is on his YouTube people. And
Yeah.
he's like, and they're advertising this, whatever it is. And he's like, tell me more about
Yeah.
it. Cause I interpret
Yeah.
things for him. But there's obviously a need for men to get the help
Yes.
and support they need.
Yes. Yeah. So there's someone that I work with kind of closely, and she's a mental health coach,
Hmm.
and she found this wonderful niche, men's mental health. And what she does is she reaches out to like labor type of jobs, like people that are, fixing the roads, or plumbers. Auto mechanics are a big one with
Hmm.
depression. And then a lot of them, she meets them where they are. Sometimes they have shifts overnight, so she goes out to them at
Wow.
like 2 o'clock in the morning, and they're all sitting in a conference room, and she'll ask them, how many of you have experienced someone who committed suicide in your family or a close
Mm,
friend? And
mm.
90% would raise their hand.
Wow.
So I think, so following her lead, reaching out to these men,
Hmm.
so in these male dominated jobs.
Hmm.
So that would be a good way to fill in that gap. So yeah, I mean, I may start reaching out to uh, there's a really large auto mechanic shop here, but it's a chain.
Mm-hmm.
So I may reach out to them and ask if I could give them a talk. And
That's a great
because
idea.
it's just such a hole. And
Mm-hmm.
a lot of men, I mean, they don't want to take care of their health unless you're in their face
Mm-hmm.
in a nice way, in a
Yeah,
good way. I mean,
yeah, yeah,
in a good way.
yeah.
So I think that would be a nice little, spot for me to
Well, even
probably.
when you mentioned women's hormones, but men deal with hormone issues as well. And even when you said
Mhm.
auto mechanic, I'm thinking, and they're all around all of these fumes and chemicals that mess
And
with hormones,
toxins, yeah,
and then
yeah.
there's a lot of links between the kind of jobs that our men are working, the environmental
Mhm.
toxins,
Yeah,
and hormone health. And so a lot of times, again, my
yeah.
experience has been usually, when they're younger, they're like, I don't need this. And it's not
Right.
until,
Mhm.
I don't know if I
Yes.
can say libido on the air or not, but if I need to,
Yeah.
if I can't bloop that out,
That
but
is their number one question coming
that
into
is
me
it.
is libido.
That is it.
It is.
And
It affects everything. Yeah.
and that's the thing
Yeah.
is like they don't realize how much digestion affects this, and how digestion affects blood pressure, and how this
Mhm.
affects that, and how those chemicals that they're around, and the fumes and the toxins and the even the food we eat. Because a lot of the men that I would have, they would be in jobs where, well, I can't stop and eat a healthy meal. And it's like, it's a mindset change that has to happen, not just for the women that come see us, but for the
Mhm.
men too. So
Yeah.
I'm going to kind of jump a little bit. We're not done talking, but I just want to jump because you mentioned being
Yeah.
in Michigan. But what
Yes.
if I'm watching this and I don't live in Michigan? Does that mean I
Yeah.
can't get your help?
Yeah.
Do you offer virtual? How does that work?
Yes, I do offer virtual client visits. So, yeah, all they would have to do is um, contact me. I could send them their health intake form. I would send instructions on how to do pH testing with their saliva
Mhm.
and urine. I would ask for iris photos, and I would send a little.
Yay.
Yes, yes. Oh, iridology. That is uh, the number one area modality where my clients love it. They
Yes.
love it.
Yes.
But I would ask for face, tongue, and fingernail
Mhm.
pictures
Mhm.
through I could evaluate through traditional Chinese medicine,
Right.
iris photos.
Mhm.
That has a whole map of your iris. I'm not actually I'm covering it. But I do have a map
Yeah, I
behind
saw
me.
that.
Did you see that?
I
Yeah.
saw that
So
earlier.
I have that there. Yeah. So I have that there. And I also do muscle testing
Yeah.
as well. And I can do that also at a distance.
Mhm.
And I may ask for them to send me something like I would have them write their signature on a note card. So I have their energetic imprint here because I run my bioresonance scanner. I currently have a Zyto,
Mhm.
and where I can hold on to their energetic imprint, and I'm a surrogate, and I could just check the health of their body, all their systems, and check which foods their bodies like and their bodies don't like,
Right.
and give them a good recommendation of that. So,
Right.
yeah, I may be upgrading. I'm not sure if I'm going to upgrade to the
Cool.
Elite of
Okay.
Zyto, or I'm
Yeah.
going to do the Quest 4. I'm not sure which one.
Yeah. Well, and what I love about this
Mhm.
is because I have even members of my own family,
Yeah,
who are like,
yeah,
you can do all that kind of what do you mean you can do that? And so
yeah.
here I'm gonna be honest and just say I love that you're a nurse, you have a
Mhm.
practical scientific education background, you're married to an oncologist, also a
Right, right,
medical scientific background,
right.
and yet
Mhm.
you're saying that
Mhm.
these natural these naturopathic
Mhm.
assessment tools that we
Yes.
use are valuable and
Mhm.
can get us a lot of
Mhm.
information. The because I'm with you. I've used Zyto. I
Yeah.
have the AO
Yeah.
scan now that I
Yeah.
use. And
Mhm.
so there are the frequencies of our voice, of our signature,
Mhm.
all of those things, they are imprinted. And,
Mhm.
without getting weird, but quantum physics shows
Yeah.
that these things continue to hold an energy. So it's not woo woo. It's not like, ooh, we're doing
Oh,
something
no,
weird.
no, no.
It
No, we're
sounds
yeah,
weird
we
when
are
you say
more
it.
yeah. Yeah, Dr.
Right.
Briner, one of my mentors, Dr. Barbara Briner, she would always say, we are more than just a body. We are more
Exactly.
than just a body. Yeah. So,
Exactly.
and we are, I mean, you can tell, I mean, just if you're just in a room and someone very angry walks in without even looking at them, it just starts to feel yucky.
Right.
Why do I
Right.
feel yucky?
Yeah.
Oh, well, that's why.
Right.
Someone's
Or
having a
something
bad,
scary happens and
or
the hair on the
yeah,
back of your neck stands up or you get goosebumps or
yes,
something. That is
yes.
just a physical
Hmm.
reaction to an energy
Hmm. Yes.
that has come into the room. And so
Hmm.
we're not, again, it's like, I just want to assure people that we're,
Yes.
there is
Hmm.
scientific proof that you can do this.
Absolutely.
Now,
Hmm.
if you're in Michigan and you can go visit her in person, I would
Hmm.
definitely do that.
Yeah.
But, if you're going, this is the kind of help that I might need. Someone who,
Hmm.
like you, who's gone, I've been through some tough things. I've dealt with things and I just need some answers,
Hmm.
and you're going, because you're saying I'm a guide.
I,
It's like I call this series The Healer's Journey, but we're not actually saying that Rosetta or myself, we're not actually saying, well, we give glory and honor to God and Jesus for healing, because God is the one who
hmm.
designed our bodies to heal,
Hmm.
right? And
Yes.
Jesus is the one who took the stripes on his back so that we could be healed.
Hmm.
And that's all we're
Hmm.
saying. And it's so, all right. So if you can go visit in person, do that. If you need to do it virtually, you can do that. And, I'll have our show notes, I'll have the links, and all that, so you can
Hmm.
reach out to her. So I'm just curious, if you could share, um, something that you're going, if I just had, one thing that I would say to the listeners of going, what's the most important, what's the one thing that you would say, this is what I would recommend on someone's healing journey?
Well, I would recommend, so if I guess it would depend on where they are. Um, I, I would have to meet them where they are. Yeah. So
Okay.
I would, yeah, I mean, without, if someone's a little bit more, advanced with their journey, their spiritual journey, then I'll definitely meet them where they are there. If someone's coming in and says, I don't believe in any of that, but, I don't have any energy, I
Mm-hmm.
have anxiety, and then I'll just, kind of work on a surface level. And so what's the most important thing on a healing journey is um, you have to participate
Mm.
in the recommendations.
Okay.
So I'm not, I can't fix the problem.
Mm-hmm.
What I can do is make recommendations. So
Mm-hmm.
the biggest participant in the healing journey is the client. So they
Yeah.
have to want to do this,
Yeah.
and they have to understand that it is not an overnight fix,
Right.
and it takes time. It takes time to unravel.
Mm-hmm.
So, if someone's been sick for years, let's say someone hasn't felt well for the last 5 years,
Mm-hmm.
okay, so, it may take, a few months before you start to feel better. And I think
Yeah.
the first thing that lifts is your emotions. So,
Mm-hmm.
and emotions tie into your physical health as well.
Mm-hmm.
So once your emotions lift, then your physical health starts to feel better as well. So,
Wow. Okay.
yeah, so you have to be an active participant in it.
Mm-hmm.
And you'll have to allow some time for the unraveling.
Yeah.
Um, yeah, yeah.
That
If your
is
body's
really
pretty
good.
overwhelmed,
Yeah, go ahead and
yeah.
finish your thought.
No. Well, so if your body's pretty overwhelmed,
Mhm.
it's going to take, I'll just give a little example of one of my
Mhm.
clients.
Yeah, I
So
do.
this I think she's 75 years old. So she came to see me, and she's had just a lot of inflammation and pain and low energy levels.
Mhm.
And she came to see me, and she had a big bag of 30 supplements. Okay,
Wow.
30 supplements. And I think a chiropractor, I mean, who did muscle testing, and yes, she tested that she needed these products, okay? But the root of it was I had to address her GI system. So once I
Mhm.
started addressing her GI system, her inflammation
Right.
went down. She's absorbing more nutrients.
Right.
And by the end of 2 months, I got her with muscle testing also. She brings in her supplements every month. I got her from 30 supplements, this big shopping bag, down to
Yes.
5 supplements because her body was able to process and assimilate. And then about 6 months later, she had some blood drawn. They're like some inflammatory markers, some blood draws, and I'm able to interpret those just because I was a nurse. And
Mhm.
so some of her inflammatory markers before the month before she started seeing me were pretty high.
Mhm.
Okay. And then 6 months later, she had the same blood draws done, and every single level came down.
Yay.
And
Yes.
I mean, most of them were normal,
Okay.
and the one that wasn't normal was a lot lower. So
Awesome.
it was a nice, a tangible a thing to see there. So
Right.
yes.
That is
Hmm.
so cool. And,
Yeah. Yeah.
like you, where I start
Mhm.
is typically digestion. I mean, almost,
Yes.
I'm not
Yes.
saying that I won't say, oh, someone's coming in with
Mhm.
this issue and I will
Mhm.
recommend a supplement. Let's say women's hormones or
Yeah.
something like that. And, I might recommend an herb or a homeopathic, whatever
Mhm.
it might be to help
Mhm.
with that. But I'm
Mhm.
like you, it's like if we don't address digestion, which for the most part, I'm going
Mhm.
to say
Yeah.
probably 95 to 99% of
Right.
my clients,
Mhm.
they need to address digestion because if you're taking 30 supplements, to me, that says you haven't, like you said, you haven't gotten to the root of the issue. You're just taking a lot of
Mhm.
different things to kind of band aid all the peripheral
Mhm.
issues. And
Yeah.
when you get to, hey, are you digesting? Are you absorbing? Are you
Mhm.
eliminating things properly
Mhm.
so that you can use
Yeah.
what you're taking? Because that's a lot of expensive urine and poop that just went down the toilet.
It's all coming out. I
Yeah.
know. Coming out sometimes the way it looks like going in. So,
Yeah, exactly. But once you address
yeah.
digestion, then the products that she started taking started working,
Hmm.
right? They would start working. So she was an active participant. I want to go back to what you said about that
Absolutely.
because, I've
Yeah.
had, I've had some very good suggestions. I asked all of the
Mhm.
my podcast guests, what's the one thing you would recommend? And I'm going to say all of them are great suggestions. That one
Mhm.
thing, and I'm like, but what you said is participation, and
Mhm.
not to me it's like, and then you said time to unravel, and I'm like, that's it. You got to participate and you need to not give up, because a
Right.
lot of times within 3 days or 2 weeks or even just a month or two, it's like, well,
Mhm.
it's not working, it's not working, but it really is.
Mhm.
It really is working. There are some things, like we said, this particular, the NAET didn't work in
Right.
particular for your
Right. But it put
boys.
me on a path of all this other healing.
Yeah.
Yeah. So it was a blessing. And she's still a wonderful friend of mine. She's retired now. So this was
Mhm.
a different naturopath that I started with. And
Mhm.
yeah, so it
Yeah.
it was just a blessing to meet
Right.
her.
And I
Yeah.
know people who have used it and they have
Mhm.
gotten results, but
Mm.
it was like you said, it got you started and you were you were the participant who says, I'm going to hang
Yeah.
in there. And not only,
Mm.
am I going to participate and do, I'm going to keep
Mhm.
going. And that is
Mhm.
so critical, I think, for
Mhm.
people who want to Especially, I mean, we're not talking about just, oh, I got a cold, or I came down with this. When we're helping our clients, they're usually dealing with things that they're not going away. They're not getting better. Even if
Yeah.
they are naturally minded and they're dealing with hormone issues or something like that, and they've tried something, they need the
Mhm.
guidance. Why do you think having someone outside of yourself is important? Like you being there to help as a consultant, as a
Yeah.
guide. Why
Yeah,
is that
well,
important?
so there's a concept about being at the top of the room, like a bird's eye view. So it's so
Mm,
you're dealing with when you're having years and years of these symptoms, you're kind of wrapped up. In you're in like the direct battle, and you're so emotionally tied to that.
mhm,
So if so someone like me coming in, there was this concept that this mental health coach, and I'm going to give her a shout out, Katie Anderson, mental health coach, Healing with Katie. She taught me this. Okay, so there's this concept of being at the top of a room. So if so if you imagine you're walking into like a dance club. Okay, say we're still going to dance clubs, and
mhm,
then you walk in and there's a lot of crowded people and a lot of interactions, and you just can't find your way out.
mhm,
And then there's a balcony, so you go up to this balcony, and
mhm.
then you could look down from a bird's eye view and say, "Oh, here's my entrance, and here's my exit."
Okay.
And there is a way out, but if you're wrapped up in your
Mm,
symptoms, you're at that ground level there,
mhm.
you can't see a way out, and you could only um, we do what's familiar. So if you indulge in a lot of mac and cheese late at night, or I mean, come, but so I mean that's just one example. But if you just can't find your way out, you do what's familiar and what's comfortable.
Right.
And then if there's someone, for example, like me or like you, who could kind of step out of
Mhm.
that noise and look at this from a bird's eye view. And you could say, well, you have this option over here, and this option over here, and
Right.
this option over here. And
Mhm,
let's get you started with, one of those that you can work into your life right now. And
mhm.
then we'll just take it step by step and just concentrate on the next step. So, and we'll reach our goal together.
Yeah.
So,
That's really good. Because I know for myself, and there are just times when I'm dealing with something for me personally, and I can go and go, oh, I need to, I should do this, or I should change that. But there are also times when I'm dealing with something and my husband will come along and he'll say, well, did you take, your Bach flowers, or did you take your homeopathic, or did you take your herbs, or
hmm,
did you do?
yes,
And I'm sitting there going,
yes.
no, no, because exactly what you said,
Yeah,
as you were telling it, I can
yeah,
picture in my mind. And I'm like, yeah, when you're
yeah,
there, you're in the crush of people, right?
yes,
Or when you're there
yes,
health wise, you're in the crush of the symptoms. And
mhm,
it's really
mhm,
hard to see what you need to do
yeah,
for yourself sometimes.
yeah,
So
yeah.
that's one of
My
those
husband does
things
that
where,
same thing for me sometimes when I'm
yeah.
just kind of stuck for, we all have our own personal issues. I'm kind of stuck, and he'll remind me of the basics. Did you drink your
Mhm.
green drink today? Because I love drinking my green drink. I always feel bad. I'm like, oh, I didn't drink my green drink today. No wonder I'm a little bit more stressed today, or yeah, something like
Right,
that. I just need the nutrition.
right,
I need the nutrition. Yes.
right. Yeah. So
Hmm.
that is a good, I like that example. And I like, that idea, because now I can picture the idea of not being crushed by, if I'm
Yeah.
picturing that ballroom or whatever it is, and I'm being
Yeah.
crushed by the people. And that's a great,
Mhm.
example of, I'm being crushed by
Mhm.
my symptoms, or the stress in my life,
Yeah.
or the circumstance, because
Yeah.
we know that stress is big. I don't know about you, but just about everybody I talk to these days, they're dealing with stress.
Everybody.
Yes.
Yeah,
Yeah.
every single person that sees me
Yeah.
has some type of anxiety.
Mhm.
Men have anxiety. I mean, it's just it's different. But it's anxiety. And the
Mm-hmm.
one thing that helps with anxiety with every single client I have are my flower essences. And,
Yes.
um, yeah, and, even my super masculine alpha men that come in, they call them their
Mm-hmm.
stress drops.
Yeah.
So they don't want to call them flower essence, but
Right.
stress drops. They work.
They do. They do. They
Yeah,
really do
yeah.
work. And and
Mhm.
that's the thing is, it's like when you think about it, stress is affecting not it's not just, oh, I have stress. It affects the musculature of the body. It affects the nervous
Mhm.
system of the body. It affects the
Yeah.
hormones. It affects digestion. So when we're doing that, when we're looking at that, it's like we've got to. That's part of the crushing. I'm looking at that going, well, the stress
Mhm.
and anxiety and worry can be part of the crushing. We tend to look at the symptoms of the body, but sometimes it's more than just the symptoms. It's environment. It's um,
Yeah.
you know.
Yeah. And talking about the stress, so a friend of mine out here who was another local naturopath, she does a live blood cell analysis,
Mhm,
which is something I don't do yet. But she was telling me that looking at the cells, apart from the person, okay, this is more quantum also, that there was a bacteria there,
mhm,
and the blood cells.
mhm,
And it wasn't being attacked by your immune system,
mhm,
by the white blood cells. But when the person was shown, was told a funny joke or was watching a funny movie
mhm,
and was laughing,
mhm,
then the blood draw that was separate from the patient, there was a lot more movement to get rid of this bacteria. So
mhm,
mood helps, a balanced mood, an elevated mood helps to improve your immune system function.
mhm.
So
Did you
yeah,
post
that,
on that about that on Facebook recently? Did you share something about
did
that?
I do that? I may have shared it. I
'Cause
made it. I may have shared it off her page, but
I
yeah, so
saw that
it was
story.
very interesting.
Yeah,
I may have shared that. Yeah.
yeah.
So it
We
was
may have to find that
incredible.
story and see if we can put that in the I'll look.
Yeah. Yeah.
Maybe we
Yeah.
can
There
find that
used to
because
be,
I
I
thought
know
that was
I used to, yeah. So I mean, that was a recent story, but I also know when, a little more than 10 years ago, I used to follow this researcher called, his name is David Wilcox.
Mhm,
I'm sorry, David Wilcock. But there's a lot more research on that, on people's
mhm,
blood draws,
mhm.
being, even countries apart.
Right.
And then if they're experiencing anger,
Mhm.
uh, the blood reacts differently. If they're experiencing joy, the
Right.
blood reacts differently. And when I say years of research, this is like research from the 1950s, the 1960s. And
Yeah,
so it goes back.
it
So
does.
yeah, the information is there.
It
Yeah.
does. Yeah, and that's
Hmm.
really cool because I think I remember reading and it was like when in the blood, because I've
Hmm.
seen at the shop that I used to have, we had someone who would come in and do the live blood
Hmm.
cell analysis and they'd take a drop of blood, they'd
Hmm.
put it under the microscope, and then they would
Right.
project it onto a
Yeah.
screen so that
Mhm.
the clients we could see what our blood was doing, and we would see the red blood
Mhm.
cells, and we would, here's the white blood cells, and oh, here are some little parasites over here, or a bacteria
Mhm.
or something like that. And so
Mhm.
what you're saying is that when we're joyful and happy and all that,
Mhm.
the white blood cells are activated to go after, but when we're
Yes.
sad and
Yes.
down or whatever, when,
Mhm.
those white blood cells are right there in the presence
Mhm.
of those bad guys, the bacteria,
Mhm.
or, and they're
Yeah.
not doing anything.
No, it's a frequency thing. It's elevating your
Yeah.
frequency. So yeah, you're, being mindful with your spiritual health, being present in the moment, doing
Mhm.
things that are joyful for you
Yes.
will help your overall health.
Yeah.
Yes.
And that's
Hmm.
that's and that's pretty powerful when you're going. it's not just, we're looking at it. We're looking at it visually happening, that this
Mhm.
person's blood is
Mhm.
responding outside the body to what the
Mhm.
person is currently experiencing in the present tense. So that's pretty cool. So
Mhm.
that's one of the
Yeah.
things that you work with. You work with people on a holistic, not just the physical body, the
Mhm.
emotions, because you mentioned Bach flowers, the
Mhm.
energy, the
Yes.
frequency. So, are there any stories or insights that you're just going, I just need to share this because this really helps
Yeah.
encapsulate who I am and how I help people, or anything like that?
Yeah. So, so are you talking about a good testimony that gives me goosebumps? Is that what you're
Yeah,
talking
that
about,
would
or is
be
that something different?
good.
Okay, okay. Is that okay? All right. So there's two stories that come to mind. So one was this beautiful young mother brought in her 18-month-old son to me.
Mhm.
And they bought this historic home, doing renovations on it. And anyways, it had a mold problem. Okay.
Mm.
So it had a mold problem. And she brought in this beautiful little boy to me. And his complexion was kind of yellow. He was very lethargic. I mean, very sleepy and didn't really, very shy, and just didn't want to interact with me, and didn't real
Mm.
clingy with his mom. And that's why she
Mhm.
brought him in. And she also mentioned to me, her father is a medical doctor too. So
Mhm.
he had all that done first, a whole medical checkup done. And so she came to me and she says, she goes, I feel his lymph nodes here and I feel the lymph nodes there. And so just with different testing, I found that he really needed help removing this mold that was kind of stuck in his lymphatics.
Right.
So, and then along with some flower essences, and I'm very careful with babies, so young ones like that. So,
Right.
um,
Yeah.
I gave a very special, a vibropathic that was very fine tuned for this little guy, some drops to take certain times of the day. So then she brought him in the next week to see me, and
Mhm.
just a completely different child. He was happy. He got his
Mm.
complexion back. Little ones,
Mhm.
they respond so well to these homeopathics.
They
He was
do.
laughing, playing, talkative, had lots of energy. uh, he was all over my office. I have a toy basket, and he was
Mhm.
playing, building blocks, building Legos, everything. So it was
Awesome.
a huge change. And
Mhm.
that in combination with some flower essences
Mhm.
that children just respond so well to. So
Mhm.
that was one story. Another story. So in my practice, I also give healing sessions too. It's basically a deep meditative state that I go in, and I pray in alignment with the Lord Jesus Christ to help with whatever is in the highest intention of the greatest good of this client right
Mm.
now. And I don't always know what that is. And some people are very private about their past, and I don't pry at all. So this man came
Mhm.
in, and he just had a lot of sadness. And so I did a healing session with him. He came in again a couple weeks later, and he said, I never told you this, but I'm a substance user and I have an
Mhm.
addiction. And he said, after the session, he said, I didn't even want the substance. I felt
Wow.
so peaceful. There was no monkey on my back. And I still don't even want it. So it was
Wow.
so profound. It was so profound. And I
Mm.
didn't know this was that this was part of him before,
Mhm.
but just with the prayer and with the intention to heal his greatest good
Mhm.
through Jesus's energy,
Mhm.
that's what it was. And
Wow.
he was extremely thankful for that. Yeah.
Mm. Yeah.
Hmm.
Well, that's
Yeah.
really cool. So,
Yeah. It was
wow.
nice when he said it was enough. So that was really
He said
powerful.
what was enough?
Yeah, that the healing, it was enough,
Oh,
and he didn't even want the
it was
substance.
enough.
Yeah. Yeah.
Wow, that's
Hmm.
awesome. So,
Yeah.
well, that's really interesting. That's so cool. So you've been on quite a journey, and it's taken you to, helping your own family, your own children, to now helping
Hmm.
others. And that is what I love, is helping others get going so
Yes.
that they can see
Yes.
that same transition
Hmm.
in their families and their own health and stuff like that. So if y'all are watching
Hmm.
this and you're going, this sounds really interesting, I may need
Yeah.
to talk to Rosetta, may need to see how she can
Hmm.
help me, because
Hmm.
there's just so many different, women's health, children, elderly, men with, substance
Hmm.
issues. You have been
Yes.
reaching and
Hmm.
touching a lot of different lives. So if that sounds like
Yes.
something that, you're listening and you're going, hey, I might need that, do click the show notes, reach out to Rosetta, and just see,
Yeah.
if there's something that she can help you with, so
Hmm.
that you can get that essence of healing in your life going through you. See how I tied that
Yes.
in
Yeah, I
there?
like how you tied that in there.
Yeah. So
Yes. Thank you.
yes,
Thank
yes,
you.
but
This
that's
was a
so
lot of
cool.
fun, and thank you so much for
Thank
inviting me.
It has been a lot of fun, and
Yeah.
been good to get kind of catch up and hear more of your story and what's going on with you. So thanks so much for joining me.
Oh, thank you so much. And I'm so glad that we met at Trinity, and you were
Oh
one of
yeah,
my favorite instructors. So
thank
I
you.
plan on being one of your students again in the
I'm looking
future with
forward to that. Yeah. So you mentioned that,
iridology. So yeah,
yeah.
yeah.
So
Hmm.
I'm gonna, since you mentioned that, I'm gonna do a little plug, because I do teach iridology. I
Yes.
have online
Hmm.
classes. I have work at
Hmm.
your own pace classes. I have weekend away events. So y'all
Hmm.
check the show notes for that as well. See how you can hook up with me. See how you can hook up with Rosetta. And,
Hmm.
if you haven't already done so, make sure you subscribe, like, if this is on a podcast that you're listening, be sure to leave a rating and write a review and send us some love here, because we are really trying to pour out and just
Love. Yeah, love.
help other
Yes.
people get along their health journey. So again, Rosetta, it has been great.
Absolutely.
Thank you so much for joining me.